This is a training presentation for school staff on understanding risk, resilience, and self-harm. The aims of the training are to understand risk and resilience factors in order to identify a young person at risk of self-harm. It will give you the opportunity to explore your school's own whole school approach in regards to emotional resilience. You will be able to consolidate your existing knowledge of self-harm and why young people engage in it. Who is that young person not taking up your time yet? This may be a question you have asked yourself in the past. Some schools often find it difficult to identify those young people at risk early on and only become aware of the young person's struggles when they are in a crisis. One way to try and get ahead of the curve and reduce demand on your time later on is to think about prevention and early intervention. Identifying who is likely to be at greater risk before they hit your radar is important, and alongside this, thinking about how to build resilience across the whole school population. Risk and resilience is widely documented within the mental health literature. Being aware of risk factors is important and will help you identify those young people in need of early intervention. In addition, protective factors play a part and will determine the type of intervention needed to support the young person. You cannot talk about risk without talking about resilience or protective factors. Schools often are very good at identifying risk, but not so much the resilience or the protective factors. It is really important to look at resilience factors because they cushion or soften the risk, and it enables school staff to have something to use when managing risk in young people. When protective factors are high, risk is more likely to be contained. With no protective factors, this ups the risk and means school staff have to be very mindful. For example, if a young person says their parents are supportive, but they do not want them to know they are self-harming, talk to the young person about their reasons for this. Maybe suggest doing this together and let them know they don't have to do this by themselves. In bringing parents on board who are supportive will increase the amount of protective factors the young person has. However, if you have a young person who says their parents will be dismissive of them if they told them, then you would know parental support may not be a protective factor and risk may be heightened. This slide shows where you can find risk and resilience factors in a young person's life. We are not saying that if someone has any of these risks, that they will suffer from a mental health problem. Rather, that an accumulation of these risks can increase the likelihood of a young person developing a mental health illness. However, it's important to recognise that there are circumstances that pose potential risks to an individual's emotional well-being. Adverse childhood experiences, such as parental divorce, have shown to be a risk factor. However, it's important to state that this is not a universal experience, and not everyone experiences it in the same way. For example, you may have parents who are divorced, but who co-parent exceptionally well, and the children thrive. But then you will have parents who are divorced and that there is a lot of hostility and the children are caught up in the middle. So it all depends on the context of the experience. Be mindful that there are some risk factors which are modifiable, such as inconsistent parenting style. This can be modified through parenting groups, programs, and workshops. Emotional resilience is a big initiative the government are trying to push in all schools. Whole school approaches, rather than targeted support, means the school population are able to benefit from the support to be mentally healthy. Please take this opportunity to think about your school's whole school approach on resilience. What do you offer? Are you promoting resilience throughout the whole school year, or is it just in one-off workshops and sessions? Whole school approaches is something that should be weaved into the curriculum, rather than it being a one-off session. One-off sessions are valid, but sometimes it feels like it's something that needs to be ticked off. There is good evidence to suggest that ongoing discussions are more useful than the one-off workshops. It also shows to the young person that the school has an open door policy and that they can talk about anything that's bothering them at any time. Is your whole school approach working? Do you seek feedback from students and parents through surveys? And can you think of anything else to improve on? This is something we can discuss more at the future live Q&A session. The next few slides will be on case studies. Here you can practice how to identify risk and protective factors and think about what else can be done to increase the protective factors. Jamelia is in Year 9 and recently moved to Richmond to be near to her grandparents. Her mother has cancer and has been in and out of hospital. She has no contact with her father and her school attendance is poor. While in school, Jamelia complains of stomach pains and appears preoccupied in class. She hasn't formed any solid friendships in her new school. However, has joined the girls' hockey team, which she enjoys. So in this case study, the risks are that there is chronic parental illness. Jamelia has a lack of positive friendships, and she has no relationship with her father. The resilience or protective factors are that she has supportive grandparents and enjoys hockey. What else can be implemented? The first thing to do would be to identify an appropriate teacher to talk to Jamelia. You could do this by finding out the subjects she enjoys or attends more of. You might find that she only attends PE lessons because she likes sports and hockey, so maybe getting the PE teacher to have a chat with her. The purpose of this is just to find an appropriate teacher who can sit down with Jamelia and explore her concerns. It doesn't have to be the mental health lead. It's important to get into the habit of thinking holistically and using any member of staff to support a young person. We're not expecting teachers to be therapists, but it's important the young person has a bond with a particular teacher in school. This can also serve as a protective factor. Case study 2. Aaron is in year 10. He is struggling with his exams. He has fleeting thoughts of suicide, but says these occur twice a week and he has no plans. Aaron reports to have punched himself in the face a few weeks ago and says that this made him feel better. His older brother has mental health issues and his parents are focused on supporting him through this. Aaron has been with his girlfriend for 9 months and says that she is supportive. He doesn't want his parents knowing about his suicidal thoughts, but does want support. The risks in this case is that Aaron is struggling academically. There has been an episode of self-injury, and there are family history of mental health issues. Resilience factors are that he has a supportive girlfriend and that Aaron wants support for himself. So what else can be implemented? So again, the action would be similar to the previous case study. So identifying an appropriate teacher who could sit down and talk to Aaron and find out what support he wants. Talk about maybe sharing his struggles with his parents, but say that this can be done collaboratively with the school. If parents are supportive, like Aaron says, they would also want to support Aaron through this. After talking with Aaron, you may feel that a referral to the pastoral team or for counselling would be appropriate. I understand all schools have their own safeguarding policies where they have to inform parents of self-harm disclosures. But it's a good idea to think about how it is done and make sure the young person is included in it. If it is not done correctly, this could increase risk and result in the young person disengaging. So following a self-harm disclosure, think about how you would tell parents. Include the young person in the decision making. Maybe seek consultation from a mental health professional, either someone from the mental health and schools team or from SPA. Self-harm behaviours can also be one that can spread from person to person through communication. This is what we call social contagion. It can be difficult for schools to balance between minimising contagion and potentially stigmatising self-harm and increasing the young person's isolation. As a school, watch out for the young person's friends. I am assuming those of you listening have some knowledge on self-harm. Lots of schools talk about self-harm being one of the biggest risk issues. The definition of deliberate self-harm includes intentional self-poisoning or self-injury, irrespective of motive. This cycle demonstrates why it is difficult for individuals to stop self-harming. Over time, it can become quite addictive and difficult to break out of. Emotional suffering is usually the event that causes distress. It varies from person to person, and it's known as the trigger. This could be for a young person, an upcoming exam, a death in the family, or a breakup in friendship groups. It then goes on to emotional overload, where overwhelming feelings of distress will occur, which the person cannot manage, leading to the actual act of self-harm. There may be a temporary release, so a short-term relief from these difficult feelings. Slowly, these feelings turn into guilt and shame. The person may ask themselves why they have done this. They may feel that they are stupid. They may already have feelings of anxiety and low self-esteem. These are heightened, and then the person is right back where they started. Please note, people who self-harm cannot immediately stop self-harming until they replace them with other coping strategies. This slide describes the reasons why young people self-harm. The key bit to take away from this slide is that self-harm is a symptom rather than the core problem for most young people. It's a dysfunctional way of managing difficult feelings. That's the end of part 1 of the self-harm training. Please now go to part 2, where we will be talking about emotional regulation and self-harm.